Our next speaker is Dr. Sherif Khattab, who is a prominent plastic surgeon in Southern California. Currently has 2 California-based medical practices, one in plastic surgery that he's had since 1988, and then also now the Ocean Surgery Center, which is a multi-specialty facility. Dr. Khattab has much experience with the self-pay arrangement in plastic surgery, and he saw early on the efficiencies that could be gained there and how it could translate to other areas of practice, and thus the birth of the Ocean Surgery Center as the model that he wants to talk about today. So please help me welcome Dr. Sherif Khattab.
How's this sound? Wonderful. I want to thank everyone that had the vision to come and join us this weekend. This is, as Jay mentioned, an inaugural meeting. And I want to thank the organization. I want to thank Keith. I want to thank Jay and Charlie, who helped make this path for us. I'm really at a loss for words. I wrote my presentation twice since I came this morning. And I don't have time to rewrite mine after Corey's presentation, so bear with me a bit. The subject that I was asked to talk about is why. And I have a lot of ideas about the how, but that was not what I was asked to talk about. It was the why. So. And it comes from a very, very strong belief that I have. I thought initially that maybe it'll be easier to talk about why you do things, why do you believe in things. And that's very easy to do. Now, am I going to be able to forward, or Meg is going to help? So if I'm going to just tell you my reasons, these are my reasons, okay? But more importantly, I want to express to you how I reached this point, or my perception of what I needed to do for me personally to get to this point. Why would I expose myself? And I have a plastic surgery practice. Why would I come out of the closet, if you will, and expose myself to ridicule and attacks? Why would I do what Keith has done and have a real target on his back? So this is very important. It's very close to my heart. Now, before I dive in, I need to mention a few disclaimers. As excited as I am to be in front of you, I'm not a public speaker. Okay, it's been at least a dozen years since I spoke to a large audience, so bear with me a bit. I do have a strong tendency to digress, and so that's why I needed to step away from the podium. And Mr. Magid City, who sits here to our left, who's among many things, he's my chief strategy officer, my backbone, if you will. He told me, stick to the outline, so I will try to do that. The third disclaimer is everything that I'm sharing with you today is mine. It's from my beliefs, it's from my perspective, it's from my paradigm, if you will. So my goal today is 2 things. One is to explain my reasons, and these ultimately will be discussed later. But my second goal is to really raise a challenge to everyone here. And for me, that's the most important reason I'm here. And I will discuss that at the close. So, can we fast forward? Thank you. Now, we heard a lot of capable speakers this morning and later in the afternoon about very, very valuable principles. But each one of us has a perception or a perceived value for what we're doing here, and our paradigm shifts. I quote Steve Jobs because he didn't care about the facts. He cared about his company becoming successful. And I don't want to delve into how we can become successful and how we can become more meaningful and relevant, but my paradigm is what I'm talking about. I had an early paradigm, and that's from my childhood and raising. I was born and raised in Egypt. I immigrated to the United States in '79. 2 weeks later, I got my passport signed. I'm allowed to work and started my residency. And so my paradigm is what I want to discuss with you, and it'll bring me to a point of why I present to you these reasons. My early paradigm from childhood, I don't expect people to do things for me. Okay? Personal reasons, many family reasons, but I never was raised expecting somebody's going to give me a handout. It's just ingrained in my upbringing. I came to the United States. I come from a reasonably well-to-do family in Egypt, but I wanted the freedom. I really sought the freedom. And before I get too deep into personal things, there's two focus points. A plastic surgeon. I do a lot of cosmetic surgery. I was trained by a very prominent plastic surgeon from Atlanta. And I also own an ASC. I've always owned an ASC. Since 1988 in Southern California, I've had a facility because on one side, I'm a cosmetic surgeon. On the other side, I'm a reconstructive surgeon. I ran burn units in 2 countries, several states. Taking care of burn patients is one of my passions. And when I came to Southern California, and the reason I'm in Torrance, Torrance has 1 of 3 burn units in Southern California. So I always felt that a good cosmetic surgeon will be a better reconstructive surgeon. And on the other side, a good reconstructive surgeon can be more sympathetic to the cosmetic needs. It's a bit difficult to explain if you haven't lived it, but I do combine the two. And I'm part of 6,000 to 7,000 board-certified plastic surgeons that prescribe to the same ideals. But if you look at the bigger group, there's about 60,000 providers, including dentists, including nurse practitioners, that provide cosmetic treatments in the United States. So as far as ASC, I've owned my facility since 1988, my latest one since 2006. I'm one of many thousands of facilities in the United States. So I will again stress what paradigm I have developed over these years. Since '88, I wanted to be free. I had some contracts to survive. I canceled the contracts once I found out how coercive they are. It's been at least 18 years that I have had no contracts except with one entity that I chose to be part of. 93 physicians, all specialties, primary and specialty care, banded together and formed an IPA. And we were true to our word. We were true to our word. And we took care of the patients the best we could, very efficiently. And our model succeeded and grew. Grew so much that the infrastructure that we had was not sustaining it. So we were acquired by a bigger brother, if you will. And as far as the facility is concerned, I've always ran it for cosmetic purposes. And you'll see how the two linked together when I came to 2006 and linked both reconstructive surgery for my facility. But all these years, we took very good care with honor of our patients. We honored our patients. We provided high quality care. We talked a lot about quality today. If you want quality, ask the patient. If you want contract quality, ask the entities that issue the contracts and negotiate them. But if you want to talk about quality, ask the end user. So I felt that if I have my own facility, I can provide better care for my plastic surgery, cosmetic surgery patients. I also can limit their cost, which I tried to do, and I believe I succeeded to do that. After the years developed and we grew, the culture started to change. And that culture was starting to annoy me because I know all the physicians in that group. And I know we don't have total control over the process now, and we don't have control over who's contracting on our behalf. We've lost control of that. And you know, the delays started to show and appear, and I said, well, what's going on here? Well, you know, it's 2007, 2008, well, maybe it's the economy, maybe everybody's being pinched. I'm fortunate and proud to be one of the busiest plastic surgeons in my community, Torrance, but I saw that there was some attrition in my volume, and I said, are we doing something wrong? Talking about quality again. I always get year after year 97%, I'm proud to say, satisfaction rate by our patients. I do 25, 30 cases, surgical procedures a week myself. Now, but the numbers are declining. And I said, what's going on here? Well, it's the economy. They keep telling you there are reasons. And all this time, I'm a shareholder, although a very minute shareholder in this entity that became a very, very large entity. And came a time where I said, you know, the volume that you were promising is not happening, so I need to rearrange my fee schedule. By the way, all this time, my fee schedule, which I shouldn't be saying publicly, let's say at least twice Medicare. I never charge less than 200% of Medicare. Okay? I've done charity work. I've done surgeries for free, but the only contract that I've had for the 18 years past, it was high up there. Now, they said, well, if you want to have an opportunity to bill for your facility, then you need to get Medicare certification for your facility. Cosmetic surgery doesn't need Medicare encumbrances and so on. So I said, well, that's going to affect my cosmetic model. I'll have to charge my cosmetic patients a little higher. But I said, okay, there's an opportunity, there's a challenge, there's an opportunity. Let me look into that. And I managed to do that. And I got credentialed from the first time, passed, approved, and they changed their mind. That's about $2 million later, they changed their mind. So I said, okay, I can survive that. It's okay, I'll deal with it. So easily, you can build your cosmetic practice if you are true to your patients. If you provide quality, you have the best marketing tool, which is the word of mouth. It takes longer, but it's word of mouth. Now, 2011, it became obvious why they're doing this, why the reimbursement is being ratcheted down. It's another merger, a mega merger. And some of the companies represented here actually had one of their CEOs worked for that company that acquired our medical group in 2012 for about $4.5 billion. Billion dollars. So when they announced the sale, they said, by the way, 75% of the shares are signed for sale, so you can vote, but it doesn't matter. It's already approved. And so it became obvious why all this ratcheting down, forget about quality, metrics, you know, your high satisfaction rate, it doesn't matter. We're not going to send you the patients because you are not discounting your fees. So I said, okay, I'll survive that as well. No problem. And then I had what we call an epiphany. I know there's Epiphany Health here, okay? But this was really, truly affecting me to the core. For about 12, 13 years now, I've treated a patient, I'm going to call her Betty, okay? And when I first saw her, she was 82 years old. So she's about 94, 95 now. And over the years, she came through this managed care referral process. And a very endearing lady. Grew up in Eastern Europe, Middle East, had a lot of sun damage and skin cancers. I've done no less than 12 skin cancer excisions on her over the years. And she's very endearing. She's a very determined lady. She knows what she wants. She knows what quality is. She wants to know. that you truly care about her. She would not go to somebody except if it's Josh or Doug's type primary care. That's the type of person she is. And I said, okay, we'll take care of you, Betty. He said, well, are you sure? You make sure of that? I said, absolutely. And over the years, she became so close to us. I mean, it's just like she comes in, she asks about who's had a baby, who's retired, who's rehired, etc. 2011, 2012, I haven't seen Betty. She usually comes in once or twice a year for checks. Can you look at this? Can you look at that for me? And I haven't seen her. And I'm afraid to call her daughter and find that maybe something drastic incapacitated Betty. And I didn't call. One day, she shows up in the waiting room, Betty. Thank God, nobody else was in the waiting room. And Betty, I'm walking by, and we have eye contact, and she points her finger at me and says, Dr. K, who did you kill? I said, what? What? So, I mean, a lot of things started rolling. I mean, who did I kill? A patient of mine has died, and they're accusing me now. Okay? Who is it? Who's suffering? So I bring her back. I said, Betty, give her usual hug. I said, don't mess up my hair and my makeup, okay? She's 94, but very opinionated on that, very determined. I said, Betty, what's going on? She says, do you know how difficult it is for me to come and see you? And I just sat there and I said, what's the point here? What is it really the point? And I said, Betty, I told you before, even if you don't have any coverage, I'll see you. No. They wanted me to go see somebody else, and I did. And they messed me up. They couldn't even remember where the cancer was. They operated on the wrong spot. You always took care of me. So I said, Betty, you can always count on me taking care of you. After Betty left that day, I started thinking, what's the point? I mean, what are we doing here? So, and that really crystallized my outlook on things. And I started saying, well, you know, something has to change for this person so I can feel I'm one segment. I'm not two-faced. I don't have a front and a back end to me. I am whole. And that's when I started thinking about how to do this. Megan? Now, HMOs, IPAs, yes, we can say that they have efficiencies, and we've developed these efficiencies. We've developed it with 93 friends of mine in all specialties. We've managed to do that. But look at these numbers. These numbers are from the NCPA in Dallas, the National Center for Policy Analysis. And look at this, 21 years, medical care goes up, cosmetic surgery goes down. What is the difference? What is the difference? One is asking for and shopping for the value and willing to pay directly to the provider. And one is completely bundled up with all other alphabet soup of organizations and entities to reach the doctor to be treated. Yes. Now, when I started thinking, okay, what I'm going to do, I said, okay, well, let me go find some expert that can help me what to do. All these years I've developed my practice based on what I can do well, what I can do efficiently, and my reputation, and now they're taking all this away, and I don't have any other agreements. I said, okay, well, let's just do cosmetic surgery and slow down and divest some of the staff and the human resources and just concentrate. You don't need that many staff members if you're just doing facelifts and liposuction. But interesting thing about experts is, as I read about that and tried to predict, okay, what's going to come next? When is the other shoe going to drop? Nobody can really tell us. Nobody can really tell us. And experts were studied, actually scientifically studied by Professor Tetlock, who teaches at the University of Pennsylvania. Professor Tetlock did a study about experts over 20 years, about 28,000 decisions made by experts. And he compared it to dart-throwing monkeys. And the dart-throwing monkeys were more accurate on target than the experts predicting the future. I said, so there is no crystal ball, really. Well, scientifically, that is true, because as you talk about spreadsheets and projections and expectations and what you can predict for the future, how many people you're going to hire, how many contracts you need to survive this year, there is, and I'm not fluent in statistics, but there is a difference between being precise and being accurate. There's a difference there. Also, these spreadsheets have, actuarial projections. They may have a low standard deviation, but have a very high standard of error. Think about that. So I said, well, if you want to predict the future, you've invented it so far since your youth, let's do that again. And I said, okay, well, I'm seeing patients from other HMOs that are not really trusting what they're being told. So, whether it's this problem or that problem, and they come and ask me, what would you charge me for it? I said, okay, well, that's okay. So cash prices for breast reconstruction, cash prices for cancer surgery, cash prices for difficult wounds, patients that are falling between coverages. And then I seek a haven. I said, am I crazy here? And then I find Dr. Smith. Okay. And he validates that I'm not crazy. His mere presence validates I'm not crazy. Okay? And he is, okay, let me back a little bit. One of the biggest compliments you'll ever get in your life is for somebody that you admire, you respect, invites you to your home, to their home. Okay? And for that, I'm here. I shook hands with him this day. I said, there's no way I would have missed it. Okay? So it's important to really know what you want. What is your perception of what the right thing to do? And I'm just talking about this, yours truly. Now, after Betty left, and PIPAKA has been around for a few years now. Everybody talks about PIPAKA or ACA, as if this is it. Thanks for Corey making the history clearer. But PIPAKA is just the last attack, if you will. You can argue that it started in the 1850s when the AMA, the body representing physicians was saying, well, not everybody should be treating people. So you can go back as far back as you want. So PIPAKA is just, I think PIPAKA is an opportunity because it's like an 8 or 9 Richter earthquake. For Southern California, that's meaningful, okay? So it is what it is, but it also creates, it shakes the infrastructure of everybody. I was told 2 weeks ago in Charleston by somebody who sat with the big insurance company saying that maybe the insurance companies are also feeling the earthquake. And they don't want single payer. Because if they do get single payer, maybe the whole structure will come tumbling down. Now again, I don't know. That was an expert that was talking to me. So which brings me to my reasons. By the way, this is what PIPAKA would multiply the slide by about 5 or 10. This is what goes between the physician and the patient before PIPAKA. Before the unaffordable care act, if I can use the name that Dr. Smith has given it. This is what we had to deal with to process an insurance claim to get paid, to pay your staff. So after PIPAKA, you'd fill this slide with another alphabet soup. Some of these are actually, DME goes twice. They're running out of alphabet soup. So what are my reasons? Why am I standing in front of you? Why am I discussing this? Well, I stand to gain. And I'm not saying this as a disclaimer. I'm proud of it. I came to this country because I stood to gain. There's no denying it. We all stand to gain based on what we are willing to work hard for and perceive and achieve. So as far as gaining, it's not always financial. It could be a number of other things. And for me, I can't be living the two lives. What's inside has to be outside. Legacy for my family. At my age, I can retire easily and comfortably. But I need to have my kids and maybe my grandkids in the future say, well, maybe Grandpa was a little crazy, but he believed in something. Okay? All my life, and I don't know how many of you share this, I just hate bullies. I just hate bullies. And now, there are bullies that are incidental bullies. I'm not saying anything bad about anybody here, but there's incidental bullies that are unintentional bullies, but they do exist. And then there's perpetual and methodical and strategic bullies, okay? And so I do stand to gain on that, and I declare it with pride. Patient-physician relationship. All physicians in North America, most physicians that I know even outside the United States, I dare say that they're willing to see patients for free. They're willing to treat patients and extend the hand of help for free. Now, we get paid twice as providers. We get paid financially on one side, but we also get paid by the true value that we extend to our patients. And there is nothing you can compare that to. There's nothing that you can compare that to. Until you live that, you can't, it's difficult to describe. At least for me, I can't put it into words. So when I listen to Doug and Josh and Atlas MD, and you can sense what they're about. They'll do the right thing. They'll do the right thing even if nobody else in Wichita is willing to even listen to them. So patient-physician relationship is very, very important part of my paradigm. Economic reasons, well, I have colleagues that are not plastic surgeons, and they don't inject Botox or do liposuction on weekends, and I've seen them suffer economically because of the choices they made or where they placed their trust, if you will, with this organization, that organization, saying that they will get more referrals for discount or more volume, or ultimately after their professional productive years are behind them, they just get stroked off because they didn't decrease their fees by 10%. So my colleagues are very important for me too, because no matter how successful you are in any field, somebody has helped you. Personal reasons, I have a son who had no desire to be anywhere close to medical field. And he went to film school, study video production, be a movie producer or a video producer. And after 3 years, he said, Dad, I'm sorry, but I can't do this. I said, well, why? He said, well, it doesn't matter how good I am. It doesn't matter how creative I am. If you're not in the in group in the movie business, you're going to suffer. You're going to have to struggle and find another job while you're trying to get your path. And then he ultimately changed his career, and he's applying for medical school as we speak. So I don't want him to come to a profession, I still call it a profession, not an industry, not a business, but a profession that is so smeared with outsiders telling us who we are and what we stand for. That's difficult for me to swallow. And then the making a difference, and I loved every speaker that came up here. The ministries, they want to make a difference. Their core beliefs, okay? And all of us have to respect that, okay? The people that stand to gain for business, we respect that as well. By the way, if a ministry or a church does not run its organization like a business, they don't stand a chance of recovering financially. So making a difference brings me really to the challenge that I wanted to present to you. And I know the talk is about the how, the why, but how can we mainstream this? If this is the freedom-loving, smart people that know what is right and what is wrong, and and know the difficulties and the hurdles, and how can we come together and make this mainstream? Okay, and I'm counting on you. So that's I think is the biggest challenge for us. And I had the honor of knowing Congressman McEwen, who retired from politics in '93. He does not know me, but I know him. And he's an eloquent speaker. He can speak about anything and relate to you. And what I wanted to do is tell you how difficult that challenge is going to be. So he tells a story about the railroad gauge.
The U.S. railroad gauge is 4 feet, 8 1/2 inches, the distance between the rails. That's an exceedingly odd number. So why was that gauge, 4 feet, 8 1/2 inches exactly, why was it used? Well, it was used that because the way they built the trains in England was with that width, and the U.S. railroads were built by English expatriates. All right. Why did the English build them like that? Well, the first railroad lines were built by the same people who built the first railroad tramways. That is where you put the railroad car on, it was pulled by horses, and that's the gauge that they used. And then, of course, eventually they replaced the horses with a steam engine. Well, why did they use the gauge at 4 feet, 8 1/2 inches? Because the people who built the tramways used the same jigs and tools that they used for building the wagons, which was the same wheel spacing on the road. Okay. Why did the wagons use that odd wheel spacing? Well, if they tried to use any other spacing, the wagons would break on the rocks that were along the road, because all the long-distance roads, the spacing was for the old wheel ruts of that width. All right. So who built the old rutted roads? The first long-distance roads in Europe were built by Imperial Rome for the benefit of the Roman legions. The roads have been used ever since, and hence the ruts. The initial ruts, which everyone had to match for fear of destroying the wagons, were made by the Roman war chariots. And since the chariots were made by the Imperial Romans, they were all alike in the matter of their wheel spacing. Thus, we have the answer to the original question. The United States standard railroad gauge of 4 feet, 8 1/2 inches derives from the original specifications for an Imperial Army war chariot. And so when people ask you, where did this come from? What horse's rear end came up with this idea? The fact of the matter is that the Imperial Roman chariots were made just to be wide enough to accommodate the back ends of 2 war horses. So because the 2 war horses were wide enough, and hence made the ruts for the wheels from whence we came, here's the rest. When we see the space shuttle there in Florida sitting on the launch pad, there are 2 big booster rockets attached to the sides of the main fuel tank. These are the solid rocket boosters, or the SRBs. The SRBs are manufactured by Morton Thiokol at a factory in Utah. The engineers who designed the SRBs would have preferred to make them a bit fatter, but the SRBs had to be shipped by train from the factory to the launch pad in Florida. The railroad line to the factory runs through a tunnel in the mountains. The SRBs had to fit through the tunnel. The tunnel is slightly wider than a railroad track, and the railroad track is about as wide as 2 horses' behinds. So a major design feature is arguably the world's most advanced transportation system is determined by the width of 2 horses' rear ends. I said,
He concludes here, and I turn my mic off. People left to their own devices will never change. So, thank you.
All right, doctor. What's the how? How did you post your prices?
If anybody has noticed, I hope nobody has in this room, but I followed some principles that I learned from Dr. Smith, and I came to Oklahoma City, I think it was January or February was the earliest that he had time, and you know, is this real? I said, yeah. I said, well, how do you do it? I said, well, here's what we do. And I said, okay. Can I adapt it to California? And he opened my eyes to some things that he made me understand principles of freedom as opposed to ideology of freedom. And the principles don't change, regardless of what party you belong to. The principle is the principle is the principle. You cannot break it, okay? So that was very vital for me, and then I went and found the mechanism. Okay, well, who wants to? I used his phrase. I used Dr. Smith's phrase. I said, you know, you bring a surgeon and say, okay, can you do gallbladders for me at my facility? I said, what? He said, yeah, I have all the equipment you need, the highest quality, the assistance. Would you do that? I said, sure. You have the patients? I said, sure. So what do you want to charge for your gallbladder? And I don't know if I'm at liberty to say this, but he said, I don't know. So my take back was Dr. Smith's exactly. Do you want to tell me, or do you want me to tell you how much to charge? And usually there's silence in the room. Now, 90% of the physicians that I approached were welcoming. One was, he gave me actually 10 times what he usually charges, and he was hoping he thought maybe I'm getting patients from the Middle East, Dubai, or somewhere, you know, and so I charged what was reasonable with a profit. And that's in a nutshell. We can talk about a lot more details because each procedure has its own set of specific needs. Be happy to talk off the podium about implants. There's only 2 places that manufacture implants for planet Earth. One is in China and one is in South Korea. The only thing that differs is the stamp, which, you know, and I have access to both, but I deleted that from my, that was 4 years ago. 4 years ago, somebody said, well, you know, we can get these implants directly, and there are programs right now, and but that's a side issue. So I hope I answered your question. It's what's reasonable, it's what's fair, and let the market dictate. Dr. Smith has opened my eyes to something else. I realized that in the state of California, all hospitals have to publish their prices, their charge master prices. So the lowest price is, I believe, $8,000 or $9,000. It's on the web. This is not privileged information. And it's in a hospital that doesn't do gallbladders. That's Lab Coli. And the highest price, if you're ready, It's Kindred Hospital in a city called La Mirada in Southern California. It's LA County. I believe it's LA or on the border of LA and Orange County. They charge $141,000 for laparoscopic cholecystectomy. So, and actually the CEO was asked, why do you charge such high prices? Well, the sheikh mentality. What is the sheikh mentality? Of somebody that's going to come, a sheikh from the Middle East who's got a suitcase full of cash, at least once we can charge that much. We don't want to leave money on the table, basically. Again, that's the paradigm. That's the perception of this organization. And that's their operating model. But let's not, the how is easy. If you adhere to certain principles that you can live with, whether you're an employer group, whether you're a TPA, whether you're an alternative risk, and we all have to come together and hopefully figure out the right way.
As an administrator who's moved my surgery center to transparent bundled pricing, sometimes the biggest concern is the unexpected hurdles that we can come across, the unforeseen challenges. I was wondering if you could share maybe one of your hurdles that you came across when you first did this and how you overcame that.
What's your name? Chris. In 1988, I started my practice. Before 88, I was in residency, plastic surgery in Kettering. There's somebody here from Ohio, close to Kettering. So in a teaching institution, there are resources that you use. And Stan, if you're still here, I do sympathize with what you shared with me as soon as I walked into the room this morning, that teaching institutions have obligations to their nursing education, et cetera, et cetera, et cetera. In the cosmetic practice, you promise the patient, I'm going to do your facelift, this is how much it's going to cost. Up front, when you tell the patient this is how much it's going to cost, that's a promise. In a free market, that's a promise. You're going to deliver this service. So you have to be very clear what you're promising, what are the services, what's included, and definitely what's excluded. Okay. Maggot, he says, you can't guarantee quality. I said, no, I can guarantee that it's the highest quality that I can provide, but I don't guarantee results. Okay. So this, and quality on the provider side is different from, as I said, perceptions. So you have to, when you go into a contract with a patient one-on-one, it's even a higher calling, if you will. You have to be clear. What is it you can tolerate as far as risk? What is it you cannot? So there are certain procedures you know up front they're very high risk. It wouldn't be in the patient's best interest to accommodate that. You have to be very, very smart. But spine surgery is now provided on outpatient basis, but only single level, and in the best hands of neurosurgeons, maybe 2 levels. But you can do it. You can do it safely, or you can do an overnight stay. So you have to be selective. You have to be selective and ask. And the people who've done something, they'd be willing to help you because you give us relevance. If that makes, I mean, if you look farther ahead, and that's really the challenge that we have, is we need to, the slide about the history, since 1857, there's been people trying to institute rules to avoid the coercion, but they were not relevant, or maybe they were relevant for a small time and then they disappeared, or maybe not enough relevance, that we were drowned in the sea of mirrors and smokes, and I mean, I don't know what to call it, but it's Corey mentioned a word, scam, okay? And you have to be very careful when you do this. Very, very clear and careful. There are scams that are poured upon you without you knowing. And some of my colleagues that have signed their management to their office management to an institution. If they don't like how the provider is producing for the institution, because they take a percentage, they squeeze them a little bit. Well, how's that? I said, well, you know, just delay the billing for 60 days. Okay? And if you have obligations, the billing goes out late, the receivables accumulate, the payables are behind, and you still have your mortgage. You still have to send your kids to college. And so, I mean, so you have to be very careful. I don't know if I answered your question. I'll take this moment to answer the scam because I see the cosmetic practice where it's totally free market, and this is a problem of the future as I see it, because I think there will be relevance and we'll be dominant and we will be mainstream. It's just I don't know how yet, but we will be because the desire, and PIPAKA has, it's a big earthquake. It's affecting everybody. The society I belong to did a study a few years back, the American Society of Plastic Surgeons. They did a study, wanted to know what the customer wants. And we spent millions of dollars, experts again, and we found out what we already know. The cosmetic patient wants everything. They want to look slim, trim, young, beautiful skin, no blemishes, instantaneously, buy a pill, zero pain, and zero cost. So we know that. We all want that. Individually, we all know that. And that's what I told Stan earlier today. Yes, there is community obligation to nursing education, medical education, etc. But also, the individuals that are consuming could be part of the scam. And in my community, that's been prevalent for 25 years through the PPO process. I can't say from the podium how mechanically it happened, but you know, but it does happen. It does happen. You can be coerced into a corner, and then you got the FBI saying you've done wrong. So you really have to do your homework. And I'm glad that this room has enough of the minds and enough of the people that can help you through that.
Other questions? Well, thank you, Dr. Khattab.
Thank you.